Hello, good afternoon to all. My name is Abhishek Gautam, and I work as Associate Director Research, Gender and Health at International Center for Research on Women, commonly known as ICRW. Yesterday, we all celebrated the World's Population Day, and this year's theme is Unleashing the Power of Gender Equality, Uplifting the Voices of Women and Girls to unlock our world's infinite possibilities. And given this year's theme, it makes it all more imperative to have today's discussion on how women's autonomy and decision-making can effectively be measured. On behalf of Family Planning, Monitoring, Learning, and Evaluation Consortium, it gives me great pleasure in welcoming you all to our 7th webinar, which is on measuring women's autonomy and other gender measures for family planning programs. Before setting the context and introducing our esteemed speakers, let me give a brief background of the FPMLE consortium, which is hosting this webinar. Many of you might be aware of this consortium. So the FPMLE consortium was constituted in 2015, almost 8 years ago, with the goal to provide grounded evidence on efforts to improve family planning in India, with particular focus on the states of Bihar and Uttar Pradesh. The consortium is led by population councils and brings together the technical support unit in both states of UP and Bihar. For Bihar, it is Care India Solutions for Sustainable Development, and in UP, it's India Health Action Trust, IHAD. The other partners in the consortium are International Center for Research on Women and the Center on Gender Equity and Health, University of California, San Diego. The collaborative and collective effort of this consortium was to support the family planning program with data-driven evidences. In today's discussion, we are going to learn about gender measures and their roles in measuring women's autonomy in family planning domain. As you all know, globally, family planning programs are revisiting the conceptualization of and the measurement of reproductive agency, which is one of the key aspects of demand-side determinants of contraceptive use. This has led to a growing need to understand what are the enablers and the barriers that affect women's perceived and actual capacity to effectively exercise reproductive control. Now, to deepen our understanding of reproductive agency in family planning, it is very critical to have greater consensus on conceptualization, locating the user's journey within a relevant theoretical framework, as well as operationalizing the measures that can capture these agencies in the surveys that we conduct. And we all know from past many years, we have been relying on the measures that are available in DHS, like household decision-making, women's mobility, domestic violence. But today we are going to hear and discuss about some of the key additional measures that as a consortium, we developed, adapted, refined, and tested in field. We will also hear about how these measures can inform FP programs and strengthen the approaches and strategies at various levels of the ecosystem. So with this background, I would like to introduce our eminent speaker and discussants. So today our speaker is Dr. Nandita Bhan, who is professor at Jindal School of Public Health at OP Jindal University. Nandita by training is an epidemiologist with degree in public health and social behavioral sciences from Harvard University and University College London. She was part of Center on Gender Equity Health at UC San Diego and Public Health Foundation of India previously. Nandita's work focuses on social inequalities, particularly the role of gender equality and social behavioral and structural determinants of health and well-being. She uses in her work the life course perspective in engaging with development, health, and well-being of women and girls, and examining gender and social inequalities in health services, service access and use. She has also worked on research and capacity building on gender and sexual and reproductive health for field program monitoring and evaluation, with particular interest in issues of adolescent agencies and in addressing measurement and data gaps in gender empowerment. Her research and teaching emphasize on utilizing both quantitative and qualitative methodologies to improve the measurement of health and well-being, of urbanization, and behavior change interventions in low and middle income countries. Nandita also sits on International Advisory Committee of Lancet Child and Adolescent. Welcome, Nandita, for the webinar. And along with Nandita, we have two distinguished discussants, Dr. Priyananda, who is currently an independent consultant with expertise in research and evaluation and grant making on gender and sexual reproductive health and right issues. Till April 2023, she was Senior Program Officer with Bill and Melinda Gates Foundation at India Country Office. She led monitoring, learning, and evaluation team, where she handled grant making on research and evaluation for the foundation's technical assistance to support health system strengthening and family planning, with focus on gender, social norms, and equity. Prior to joining the foundation, Priya served for a decade as Director of Social and Economic Development Group at International Center for Research on Women Asia Regional Office. In this capacity, Priya led several research, policy, and programmatic work on issues related to gender equality and poverty reduction, with a very special focus on intersections between economic and health issues. Also, from 2014 to 16, Priya was co-director of ODI-led research consortium on gender and adolescence, global evidence. Priya holds a PhD in health economics from Johns Hopkins University and Master of International Affairs from Columbia University. She is also an adjunct faculty at University of North Carolina, Department of Maternal and Child Health. And she was one of the members of Women Left Health India cohort for the year 22 and 23. I welcome you, Priya. And we have the second discussant, who is Ms. Preeti Anand, who leads the family planning program and gender integration work of Uttar Pradesh Technical Support Unit in the state of UP. She provides technical assistance to the government of Uttar Pradesh to improve access, availability, and quality of family planning services. A visionary with a strong collaborative ability, Preeti not only manages donor and partner relationship, but also efficiently contribute into state-level strategic planning on family planning and gender integration. She leads a team of experts who support the government in strengthening family planning intervention across the state. Her niche is in program management and compliance of large-scale projects. She has designed, developed, and helped adopt behavior change communication campaigns for family planning, reproductive health, as well as HIV. So I welcome you, Preeti, too. And now, without taking much time, I would hand over to Nandita to make her presentation and share the learnings and the findings that she has. And Nandita, you have around 20 minutes to present your findings, followed by Priya and Preeti to provide their reflections in 8 to 10 minutes. Over to you, Nandita. And I would appreciate and really request all the participants to please make this session interactive and post your questions in Q&A or chat so that we can keep on responding to it. And we will have around 15 to 20 minutes towards the end for Q&A.
Thank you, Abhishek. I hope you all can hear me well. So I'm going to say firstly that this is some work that I had done in my previous role at the Center on Gender Equity and Health, but it's work and ideas that are continue to have resonance. A second thing I want to say is that this is the work of a collective. Sorry, my slides are not moving yet. Sorry, this is the work of a collective in the sense that I sort of present some of the ideas that are led by the Center on Gender Equity and Health, but it is work that is also coming from a real partnership, and I think we want to talk about a little bit of that hopefully in the discussion section, because this is a partnership between researchers and implementers and people, and a very active one, and as you will see in the presentation itself. But the ideas around measurement of gender-based measures, these are ideas that are being discussed very actively across forums, and the recent IUSSP webinar was one more example of where some of these ideas are being discussed. And there are a number of cross-national efforts that are currently engaged into looking at measurement. Many of them are led by researchers in high-income contexts in the US. So they're being led at Hopkins, they're being led at Guttmacher, at UCSD, and so on. So there are a number of efforts that are going on. But one of the gaps, and that is something that there has been a sense that there is a need to kind of decolonize, in a sense, some of these efforts, and to have an India-led initiative that could also speak to some of the conceptual and measurement aspects. So essentially, the idea being that our family planning programs, and this is not true just for India, but across the world, most often consider women as the users of family planning services. Most of FP products and services are sort of catered towards women. But there needs to be a greater consideration of the priorities of women, their desires, the barriers they face in accessing use. And that piece keeps getting somewhat, if not neglected, at least sort of on the back burner. When we view programs and we look at the success of FP programs, we usually consider total fertility rate, TFR, or we consider MCPR, modern contraceptive use uptake. And there is a need to question that, there is a need to question whether that is enough. And what really happens to choice, what really happens to women's desire for use and, their own sort of lives, like how are these entrenched with you? So there is a real need to kind of question what our goals are in FP programs and also think about other aspects. So things like fertility desires, intentions, pressures are often sort of a little bit on the back burner, or do not receive enough attention. Couple dynamics that play out in ideas, especially I think we measure decision making a lot, and I want to come to that measure later on. But we don't really investigate, how those dynamics play out. Who gets a say and who gets to make that decision. I think we often focus on the endpoint of that use. Or son preference, how does that play out in terms of family planning, contraceptive choices? And I think one of the issues that is really perhaps that can explain some of this is how do we envision the role of men? What is male participation? So some of these issues that are gender related have often not received as much attention. So I think we've been working on conceptualizing and measurement reproductive autonomy. I think some of the work that we do in gender actually steps back and looks at women's empowerment itself, and women's empowerment as a much more multidimensional concept. And reproductive autonomy is a little bit part of that. So although influenced by the different domains of empowerment. So reproductive autonomy, just to kind of, I guess, bring everybody, to sort of on the same page. And this is a definition that's most often used, is having the power to decide about and control matters associated with contraceptive use, pregnancy, and childbearing. But essentially, it means that whether we consider the choice that women have on whether and when to become pregnant, whether and when to practice contraception, and there's a whether there, and non-use is also an act of agency, and which method to use, and whether and when to continue, a pregnancy. And this is an area I won't go into in this presentation, but it's also a very important part of the entire dialogue. So as I said, some of these ideas draw broadly from the work on women's empowerment research, but it needs but reproductive agency really talks about honing and not using generalized concepts of empowerment, but drawing from them and thinking about what some of these concepts mean in the context of sexual and reproductive health dynamics. Because I think, as many of us sort of grapple with in the FP domain, is that we are constantly balancing individual choices and couple decision making. So there's a lot of dynamics that are going on. So when we started to work on this project, I think one of our first exercises was to start talking to scholars and thinkers and start asking them, what are some challenges that you see in the work that you've done? And many of them had decades of work. And what are some challenges that you see in conceptualizing or measuring reproductive agency? So some of the challenges that came up, and I think are helpful for broader discussion, is firstly, I think, even though we are at a really interesting inflection point where there is building consensus on what reproductive agency means. But largely, I think in the many years that we have seen this sort of research grow, the scholars said that there was lack of clear conceptual understanding and there was lack of consensus. How do we define this within SRH? Partly this was due to the fact that we didn't have enough work that engaged in the evidence building of this aspect. And a lot of the evidence building relied on measures or items that are available in the DHS. And while that's very helpful in being a starting point, so for example, we've used, for many years, we've used measures from the DHS to understand and to understand women's health seeking and so on. There was a need to go a little bit beyond that, to push the boundaries a little bit and to capture like contextual nuances or field-based insights and really think about what some of these concepts within FP and even broadly within SRH mean for program relevance. Now, one of the challenges, as I said, is that there's also thinking that a lot of this development actually happens in these academic settings, most often in the sort of global north, and there was a need for greater researcher implement collaborations and dialogue for the same. And we can come back to some of these points further. So just to briefly talk about, so this work that I'm presenting comes out of a grant that came to the study team, Anita Raj, me, and my colleague Edwin Thomas. It was an India-led initiative to develop gender measures in participation. And essentially what we did was we did three things. We thought about, we decided that we wanted to review and identify the landscape. We wanted to understand, what are some strong and potential measures and what are some construct gaps. We then, building on those, wanted to develop, adapt, refine, and test. We wanted to build those measures that would be rooted in the conceptual understanding from the Indian context. And we hope that the new measures that address some of these gaps could be built within UP and Bihar. And we also had another sort of, state that we were working in. So a couple of measures were also developed in Maharashtra. And then finally, using this evidence, we wanted to engage and we wanted to build consensus. Now, this is not easy because there are a number of groups and there are often competing priorities. So even as a consortium, we're a consortium of 5 organizations that are presenting some of this work. I think each of the organizations had their own perspective, their own methodologies, their own lens, and really their own priorities. So bringing that together was not easy. So I think even outside that consensus building takes systematic effort and time. So broadly, one of the conceptual frameworks that we use in our research to define reproductive agency is we view, and this is located within the broader empowerment framework, is that we view reproductive agency as a sort of triad of can, act, resist, which is an almost ongoing dialogue between the three, wherein women, women feel a sense of consciousness or a desire towards that change or towards an action, the act that measures and describes how women act, choose to use contraception or choose to not use contraception and other decisions in that domain. And the resist, which comes from how women engage with others in the system. So for example, their family members and what kinds of pressures or even enablers are there in their system that help them overcome those challenges. So this is a framework that was developed in thinking about agency, more broadly. And then we try to incorporate it and utilize it within family planning. As part of this work, we also engaged, and as part of the review and identify, we also tried to engage with what the measures were out there. So when we started looking and we did a pretty comprehensive review, we found that there were over 200 measures, 223 measures essentially, which came from the domain of family planning or SRH that looked at one or other aspect of gender, or they were gendered in some nature. But when you start looking at these measures, you realize that a majority of them actually are limited to contraception use. And there are very few that look at other very critical parts of the family planning story that look at fertility, access to FP services, sexual relationships, abortion, unmet need, and so on. So there are fewer and fewer. And so that has been a big challenge. A bigger challenge, and that comes from the work that the center had been doing on measurement quality per se, called Emerge, is to look at the quality of what we have. And we've defined quality more broadly in terms of whether the measure had psychometrics, whether, so in a sense, did it have reliability and validity statistics? Had it been adapted for use in one or more setting, particularly one or more LMIC setting? What was the adaptation process? What was the ease of use? And from an implementer perspective, was it a short measure? Because a lot of the times implementers are not looking for something that is too long. So when we start to kind of go deeper and deeper into these measures, we realize that of these 223, 66 measures had psychometric data or had been tested in one or more LMIC settings. And of these, I think this actual list is there in the white paper. If you access that, these measures are listed there with links and so on. But you find that of these, only 31 measures had rigorous sort of, psychometrics and had been tested enough so that they could be harmonized for use. And 39 measures showed promise, as in they were measures that were either conceptually exciting, broke new ground, or they were measures where they had been tested in one setting and perhaps needed a bit more adaptation efforts and testing efforts to be able to to have that sort of evidence backing that these were ready for use. So that's the broad context. So following this, as I said before, we decided that we want to develop, adapt, refine, and test. And that was something that we did with the partnership that we have with UP and Bihar. And I want to acknowledge one thing, that this effort would not have been possible without the leadership of like PC on some of this work, without the work that was done by IHAT and CARE, and without the technical input and knowledge of ICRW. So I want to acknowledge that this is not something that it was a very complex process. So we started looking at measures, and some of the measures, as you see in the survey for these two states, we still were drawing from measures such as household decision-making, domestic violence, and mobility, just because these are somewhat more accepted measures in the field. But we started to see whether we could get additional insight from adapted measures. So these measures were incorporated within the survey with varying samples and subsamples. And this is a challenge because a lot of the times, a lot of the surveys are already set and are capturing a number of elements. So inputting new measures in them, measures which might have been long or new or whatever, required several trade-offs. So that was a process of negotiation that we engaged in. And some of the measures that we did get in from this process were FP self-efficacy, spousal communication, balance of power, FP and fertility norms, and interpersonal quality of family planning. And I'm going to kind of focus on these three, particularly self-efficacy today, and briefly refer to some of the conceptual aspects of the other two measures of fertility norms and balance of power. Okay. So self-efficacy essentially is not a new construct. I think several of the people who work in SBCC, in social behavior change communication, and generally interventions per se, have worked with this concept of self-efficacy. I think it draws conceptually from Bandura social cognitive theory. and has been applied across fields. Although in behavior change theory, self-efficacy kind of gets viewed often as an individual construct and not as much being influenced by the social world. But that's not true. That's not true. I think self-efficacy definitely represents an internal dialogue that happens for a person, but it's very much affected by the social influences around. So in a review quite a long time ago, I think self-efficacy itself has been defined by the conviction that one can successfully execute the behavior required to produce the outcome. And it is measured by understanding people's confidence in overcoming progressively difficult barriers to successful achievement of a particular behavior. So that being self-efficacy. But what is family planning self-efficacy? So in a study in Guatemala several years ago, there was some amount of qualitative work that was done to develop what might be a measure of self-efficacy in family planning. And here self-efficacy was defined as barriers to use. So, the author and her group really talked about a number of aspects. So lack of knowledge, availability, communication, fear of side effects, resistance, fear of marital problems, etc., that acted as barriers in women being able to exercise their voice. And by the end of the study, the group really talked about developing an 18-item scale that looked at access, communication, social support, and assertiveness. But in this work, no psychometrics were available. So what we did in the FPMLE is we went through a pretty long process of developing, refining, and testing these items. We did them first in UP and later in Bihar. So the items were first pre-tested in a survey in UP. This survey was led by IHAT, where they reduced the scale and dropped 3 items that didn't make sense in the Indian context. For example, contraception as a sin and so on. We did further validation work in Bihar, and this was led by CARE, where items were modified and further adapted to develop a 13-item scale. And the Likert scale was also adapted simultaneously. So when we started looking at, okay, so data was collected using the Bihar survey, and I'm presenting the Bihar survey, although UP survey also indicated very similar findings. But when we started looking at self-efficacy and what these items meant in the community, the factor analysis really segregated self-efficacy into almost like there was a bifurcation of sorts, where we had one factor that talked about self-efficacy to discuss and pursue, and the other one talked about self-efficacy to use in the face of resistance. So there was almost like a bifurcation, and there were different distributions. We tested the Cronbach's alpha, which was quite promising, and so on. And what we find is essentially that if you look at an aggregate measure of self-efficacy, particularly this measure, sometimes it masks what is happening within it. And it is only when you start digging deeper and looking at the subdimensions that you realize that perhaps self-efficacy to discuss has a different distribution from self-efficacy to use. And one related element is also, and perhaps this is the success of FP programming, is that more and more women are reporting a higher self-efficacy to discuss, but not as many women are reporting self-efficacy to use. So I want to talk about it in terms of implications and so on. We also find that the measure was fairly robust. We did a fair bit of statistical analysis, and we found that both sub-dimensions had a predictive value on family planning outcomes, be it spousal communication, modern contraception use, though self-efficacy to discuss probably has some higher estimates in terms of the odds ratios. So what did these findings mean for family planning programs? Well, the first, as I said, is that we found that those two distributions looked quite different from each other. And maybe we can think about self-efficacy as those two aspects, as some kind of intrinsic or internal dimension of self-efficacy, and self-efficacy to use as a form of external pressure or resist. And the aggregate measure essentially masks these nuances. As I said, perhaps the success of programs has been that more and more women report that they're able to raise this question in their marital relationships, but are they able to use family planning? And that's really one of the discussion points, like for FP programs, is understanding what is driving discussion and whether it is translating into use. And if it's not translating to use, why is it not? And is male engagement that missing piece that is needed to translate discussion into use? From a measurement perspective, I think it was also important for us to test this measure. I mean, it is also important for us now to test this measure in other contexts and really think about our FP program aspects working to strengthen women's ability to negotiate, and whether we can use gender transformative approaches to do that. And finally, in terms of use-related issues, we felt that the measure was too long. We constantly did hear that from implementers. And perhaps as we move forward, we might want to use sub-dimensions and smaller measures. So I want to quickly segue into two other measures. One was the fertility norms measure. Here, basically, the idea was that we do a lot of research to understand contraceptive use, but we don't have enough understanding on what is driving that fertility. And this measure particularly represented aspects related to pronatal norm, where children were necessarily part of marriage, represented pressure for childbearing soon after marriage, and had items related to speaking badly or social sanction for couples who have not demonstrated early fertility. This is particularly a concern because as FP programs demonstrate that women report pressure for fertility soon after their marriage, and there may also be aspects related to son preference related to that. So this was an injunctive norm scale. It focused on the perceptions or the expectations that women and men reported from their significant others. We tested this scale in Maharashtra. We were not able to test it in UP and Bihar, but we tested it among both men and women. And after doing significant amount of qualitative field research and so on. But one of the interesting things that we noted was the gender differences in terms of the themes that emerge for both men and women. So for example, for women, we noted that women reported pronatal norms, parental pressure for early childbearing, and social sanctions as the big themes that emerged. And men reported pressure for children, community talk, if no children, and non-acceptance or pity if they did not have children. So we figured that both men and women are reporting pressures, but those pressures are playing out differently by gender. We also found that, the profiling of who is experiencing that pressure was also slightly different for men and women. So among women, younger women, lower parity women, women who married early were more likely to report, these types of norm pressures. But among men, it was older men, men with lower education who were reporting the same. So we could also see that there was a little bit of difference in profiling. I want to also talk a little bit about a third measure that we tested in these contexts. So this measure essentially draws from some of the work around marital relationship quality and the dynamics around marital relationships, and it's called balance of power. And it measures, who has more say in important decisions, who is more committed, talking openly about sex in a marital relationship, who decides, how you spend your time together, and if there are disagreements, then who gets their way. This is a measure that is building on, sexual relationship, the power dynamics between men and women. It's previously been tested in some African countries, and it was adapted for use in Bihar in the subsample of the gender measures survey. So what is really interesting is, I think when we started looking at this looking at this measure and we started, having this dialogue about implementing it, one of the questions that often came up is, why do we measure? Why do we need balance of power? It's a family planning survey, and I think it really needs to. I think one of the things that needs to get emphasized is that the dialogue for contraception use is affected by the dynamics and the power dynamics that play out in a marital relationship. So as we're thinking about gender transformative family planning programs, one of the baseline things we need to understand is what is the power dynamic in a marital relationship. We did find that some marginal effects for looking at, having greater gender equity on both spacing methods as well as traditional method use. Although very much like the study in Kenya and Ethiopia, we also noted what seemed to be threshold effects. So it was the highest sort of tertile that showed like a clear significant difference. And there is something going on there that needs greater investigation. So I want to sort of conclude by talking about what are some reflections and learnings from the program. The first is, well, for many of us, reproductive agency is a goal in itself, but we do understand and recognize that it has very important implications for family planning use. And, it's not just in terms of modern contraceptive use, but also in terms of fertility intention, communication, looking at, like, now, I think we're talking more and more about traditional methods, but these nuances need further exploration. These need further investing of our resources, of our surveys into unpacking that, and even looking at like qualitative studies. So, and in India particularly, there is the work on norms is growing rapidly. And what our research shows from this work is that fertility norms play out differently for women and men. For men, it is about, asking about having children, community talk, non-acceptance or pity. For women, it is the pressure for early childbearing and social sanction, and whether that sanction plays out in violence, we were not able to investigate, but something that is important for us to know. And then finally, just to talk about one of the most important measures that we all work with and have worked with has been decision making. It is the most popular outcome to look at, agency itself. But the dynamics and negotiations matter, our views expressed and who has final say. There are new measures on decision-making agency from Nepal, from other contexts that are exploring that journey. And I think we also need to emphasize that it is important to know who had final sort of say, but it's also important to know how that process plays out and who has power. And as we speak of power, as work by other organizations also in the consortium shows that there is space to go. We often look at a woman and her husband or her partner, but power dynamics within households are very complex. And there is space to investigate who are the other actors beyond the husbands. Like our work and ICRW's work shows that MILs, for example, mothers-in-law, are very important. And there is a need to also investigate who are other actors and how can interventions build on that. And then finally, as I reflect on this, I think the question I want to leave probably some of you with is, how do we encourage more researcher implementer collaborations to build this field? So with that, I'm going to stop and just acknowledge that, thank you so much. And it's been great, I think, working with all these organizations.
Thank you, Nandita, for an enlightening presentation and taking us through the journey which we all have gone through together in developing these measures. And there are I have a couple of questions which we can come back to later. But one of the two very important points that you shared was about how these contextualizing and adapting these measures in the local context is very important. And given the kind of diversity that we have in our country, applying it in all contexts won't be possible. That's why the testing, the way we did it and what we have learned, that how to test on all scales, and even every items need to be tested properly, whether they are applicable or not. And then finally deciding, okay, this is the scale that we are taking forward. And secondly, on decision making, yeah, it's very important not to just rely on one point, that asking one question, that who takes the final decision, but the understanding the entire dynamics behind that decision, how that process of decision making happens, is equally important. Anyway, I would request now Priya to share her reflection, given her your vast experience in the field of research, evaluation, and gender equality. If you can reflect on conceptualization of reproductive agency and what its measurement entails. Over to you, Priya.
Okay, thanks, Abhishek, and thanks, Nandita. It was very nice to hear you present. I mean, obviously, I'm very familiar with the work, but it was nice to see it all come together. I think what I'd like to start with is just emphasize what Nandita said in the beginning. I think the reason this work was done is because, one, as a field, at least a few years ago, there was still a lot of lack of conceptual understanding around what is autonomy, agency, how do we measure it? And then once you define reliable, valid measures, what does it really is? Does it actually have an influence on some of the outcomes that the programs are interested in? And then lastly, what do then the programs do about it, right? So this was really, but what's happened, I think, in the last 3 to 4 years is that actually there's been an explosion of research, really interesting research across the globe on some very interesting ways in which gender and power issues are being measured on the demand side as demand side influencers or predicting contraceptive use. And what this evidence broadly, including the one that has that the FPMLE consortium and Nandita talked about, is telling us is that gender and power dynamics in relationships have deep meaning and then not being fully captured by a few select measures. So that's really important. And that the field of measurement is evolving and throwing up really new challenges of what is included, what is excluded, what has cross-cultural validity, and some of the discussion that Nandita was closing with. And I think what's happening is that all of a sudden we have a lot of new ways of thinking about it. And maybe we'll also now need to step back and harmonize and consolidate what do we really know and what is the most essential to actually measure. Because as Nandita told you, in the beginning, even with these few measures, there was a lot of back and forth around what could be included in an already overpopulated survey. So, you know, while this is desirable from the perspective of people who are really interested in digging deep into the gender and power dynamics and really strongly believe that this is important, it does occupy real estate that the surveys that actually are capturing many other facets of the program are not able to yield. So I think that's really important. So that's one area. The other is the underlying this evidence. What are we really understanding? I think what's really important is that it is really telling us something about dynamics in relationships that we were earlier not measuring very well, that we need to do better on. And that these reproductive journeys of women through their life course are going to change, their relationships are going to change, and even what you're measuring today may not be so valid and reliable tomorrow. So I think, like, while we have this today and it might be really important, it might also be that we have to still keep complicating our understanding of what this means. So, you know, that's really important point that I wanted to say, that the relationships are also evolving. And that one of the things that Nandita talked about, like the balance of power, and there are a whole host of other measures, I think, that she couldn't talk about coercion, is that, you know, this agency is actually interacting with a subliminal space of perhaps violence, covert use, lack of consent, lack of full choice. So there's a lot of other complicated things that are happening, which when you just look at agency, you get one picture. But when you start piecing together all the other things that I'm talking about, you might get a much more complicated picture, which again, inclusion of just a few measures. So my point here is just because these measures have been shared doesn't mean we automatically start including these measures. We still have to understand these measures within the context of a whole host of other power asymmetries and negotiations within the household and between a couple. Then I think the last thing in this area, like what does evidence means and what it's not telling us, is what we're also learning is the whole understanding of relationships and marriage is and fertility is also changing. Now we have surrogacy, we have very different ways in which marriage and relationship dynamics occur. So again, while the surveys are looking at couples in a very conventional way, what actually we understand is actually there's much more to being a couple and to intimate relationships than what a demographic survey typically allows us to measure. So I think I just wanted to say that for our listeners, that, you know, this is one aspect that we are able to capture within a particular paradigm. Now, okay, so then what is the so what of this? So we have some understanding that there is something happening in relationships around agency, around power, that have an effect on contraceptive use, and it has a life course perspective, and that it changes between men and women. Like she talked about, fertility norms are different. Very interestingly, women face a lot of sanctions, but men may be asked questions. So there are different ways, or younger women start facing this pressure, but for men, it doesn't happen when they're young. It only happens when they get older. So there are some interesting things that are happening here, which are clues for the program around what they should be doing. And what is happening is, so far the programs have had a very prosaic way of understanding how to respond to this area of women's power or women's agency. It's like, okay, the number of times we need to visit a woman, or couple counseling, or you know, the number of touch points of information. But actually what programs might need is much more creativity and imagination. What this means. So it may not be the way we were thinking about programs, and are we resourcing programs for that? And like Nandita said, there needs to be dialogue with people who are doing the research, understand the research and evidence base, and programs much more better if informed dialogues that can actually then play out into more nuanced programming. And then lastly, who needs to be convinced about this, right? What does this all mean? I think people who need to be really convinced about what this means is people who are actually funding and managing large demographic surveys, because and they need to be, and large demographic conferences and meetings where this doesn't become relegated to a small space, but it really embeds itself in a very influential way in terms of what we measure and why, and how does that affect the decisions we made around program. And some of the areas which are very important there is understanding reproductive agency and relationship dynamics within the context of sex within marriage, frequency of sex, non-binary and complex relationships, because all of that is changing. And even, I hope Preeti will reflect on it, but many years ago when I was at ICRW, I remember doing study on violence with women in UP. And what we realized was that there were a lot of women who were married, but who did not have active sexual relationships with their partners. And they were almost abandoned, but they were technically married. So so imagine a demographic survey like this asking that woman. There is also an internalized shame around what you're supposed to be doing, and therefore you may report something which is actually not really true. So I think we have to understand that relationships are very complex, and what we are measuring and what women are telling us need to really match, and then that needs to match with the program reality. So I think that's where I'll stop, and over to Preeti now to take it from here.
Hi, Abhishek. Okay, so can I come in?
Yes, yes.
All right.
Please.
Thank you, Priya. You know, coming from a pure program delivery management design perspective, I admit that there is a very stereotypical way, you know, we've been measuring family planning programs. So it is time to bring in nuanced aspects into measurement, but sitting on this side of the table where, I look at designing programs and delivering them on ground, what are those nuances is something that there is so much out there. It's confusing at times to figure out that what should be those measurement indicators that we need to prioritize and bring into the larger family planning programs. Of course, there is no dispute to the fact that rights and women's autonomy should start being at the center of designing all family planning, reproductive, sexual health programs, most definitely. Nandita showed this framework, empowerment framework, which spoke about can, resist, and act. Coming from the family planning program side of things, I would say that the can, resist, act framework needs to get combined with the informed choice, full choice, and free choice framework to really draw out measurements that will bring in all these nuances that we've been discussing through the last 1 hour. The reason I say this is that because, when we look at reproductive autonomy, it could be viewed from the life course perspective of women, since a woman's autonomy and efficacy has a different significance in the early part of her reproductive life versus when she's older. Looking at some of the data that emerged from the survey that even Nandita was mentioning, when we looked at data that was particular to UP, one thing that very clearly emerged that the situation is not the same when women report high decision making. Although it leads to high contraceptive use, the intention to use and use of modern reversible methods remained equal to or lesser than women who reported decision making. And therefore, measurements around self-efficacy and balance of power become really important to be interplayed when we're looking at decision making and that whole spectrum of indicators there, because from self-efficacy, I think would emerge a greater sense of balance of power where the women would have the right to exercise their decision making and the full set of choices that will help her make the choice around contraceptive use that is most pertinent and relevant to her life course. High self-efficacy, of course, data again showed probably contributes to high balance of power, leading to a more equitable relationship between couples, which is validated, like I said, with data that shows higher use of reversible contraceptives, higher met need. Therefore, completely agree with what Nandita and Priya said, that it's time to reimagine family planning programs based completely on reproductive rights and health, goals that are agnostic to fertility growth or decline questions, contraceptive uptake, non-use, etc., etc. Instead, we need to start focusing entirely on concerns of quality, rights, access, health, and autonomy. Men playing a very significant role in the programs that we design, because contraceptive use and choice is not really the decision of a partner alone. Most of the times it is a decision that is taken by the couple together, and improve within programs information to accurate and right information, both to men and women, bridge the gaps in understanding equally for both men and women so that the decision-making process is more inclusive of the choices that women make. So I'll stop with that. Very, very interesting discussion. Thanks, Abhishek.
Thank you, Preeti, and thank you, Priya, for your reflections. We have a couple of questions, and some of them Nandita has already answered, and there are a couple of them which I would like to put on the table for you all. You all may reflect on it. One is education is proved to be a determinant of autonomy. So if we can elaborate the role of education plays in women's autonomy and contraceptive use from the analysis, and how these measurements of autonomy and gender measures can be incorporated in routine monitoring and evaluation system for reproductive health programs. So maybe Nandita for the first one.
Yes, I do think that we do know that education has an important role, not just in terms of its value, but I think a lot of our analyses often get substratified and we start to look at higher education as a goal. Although, to be honest, the role of education often plays out much more when we think of adolescent programming, because a lot of the times FP programs are more oriented towards service delivery. It's when we think about, what kinds of programming should we think about for adolescent girls, that's where we start to look at higher education as a determinant in terms of delaying age of marriage, or looking at delaying age at first birth and so on. The truth is that a lot of these aspects, I know that they seem like this is part of FP and this is part of adolescent. The truth is we have to use a life course perspective when, we can't keep looking at these things in silos. We do know that there is an important effect. So I think I look towards people like Preeti and, all the sort of people in programming who are engaged, particularly with younger women, younger married women, because the charge for a lot of FP programs is to look at delivery of care, to look at counseling, how we do that. But we do know that perhaps the programs need to look at segments differently, like there has to be a bit more effort towards certain groups. So Preeti, over to you.
No, I completely agree, Nandita. In fact, one of the things that when we were looking at data did emerge that younger women and economic empowerment, brought in a higher level of mobility and subsequently their ability to make contraceptive choices that they wanted to make. So it was indicating towards a higher contraceptive use and higher intention to use as well. It was almost double than women in the same age group who did not have those factors working for them. So absolutely, the younger women, investing in their understanding, investing in them, really understanding, making those choices, developing the confidence to really talk about what they want from their life and what are the choices that they want to make around their fertility, about their health, about their reproductive health, etc., would definitely have far-reaching consequences than any other group that we can design programs for.
I think if I can add, I think one question, sorry, Priya, you can go ahead. No, I just want to add one thing, one question that came up, I think in the chat, and I think that's a really nice, really conceptually, it's not a question I can answer, but it's really something that we think about, is whether empowerment in other domains is, and if there's something really that unique about FP kind of, reproductive agency and how that differs or draws from other forms of agency. And we often feel that aspects such as, be it education, be it domestic labor, be it other sort of aspects, often are so intersectional and so cross-cutting that it's very hard to say, oh, this is reproductive agency and this is economic agency and this is, it's very hard to make that distinction. Just stopping there.
So I just wanted to say a few things, but not exactly about the question on education, but broadly. See, what we still don't know is what constitutes reproductive agency. So what is, how does a person have higher reproductive agency? It could be the context of the relationship that she currently has with her husband, the context of the community and family that she's situated in. It could be something that happened to her in her adolescence years, including education, that brought her to this point. So I think we haven't studied enough to know what all, in a particular cultural context, where nomadic tribes in Ethiopia might be very different than urban poor in UP. I mean, we cannot look at, these are completely different contexts. And what might be a really important or significant determinant of reproductive agency in a tribal context in Ethiopia may not be the same thing that determines agency in UP. So I think it is a very deep contextual lens, and education generally on the whole pushes the curve out. We know that, pushes the distribution out. But there's much more, because even women who are highly educated may still suffer from low reproductive agency because of a whole host of other issues that include lack of, it could be experiences. Now, going back to the work that ICRW has done, if a woman has, or a child has observed domestic violence when they were children, boy or girl, they're more likely to either be perpetrators of violence or experience violence as women later in life. So the fact is, it's fairly complicated what all goes into constituting reproductive agency. I just wanted to say that these are not just singular measures. They are very complex measures in the host of other things that are happening. Which is why I think understanding gender in a much more broader way is really important. And also, the fact is that Preeti also touched upon the fact that reproductive agency could be influenced by other factors, like some of these other measures. So I think, Nandita, you've done some amount of work on testing this against each other in specific contexts. I think we need much more of that before we can really say, how do we improve reproductive agency programmatically, which is a question people are asking. So I think one of the elephant in the room, which we don't test because we don't measure and we don't do, is just information on body literacy, right? Like, how much do young people know about their bodies and about relationships and intimacies before they even get into marriage? And because we're not doing enough of it, we don't test it, and we don't know how much that influences reproductive agency. I think with the Udaya data, because it's longitudinal data, that some of that has been unpacked and tested. But I think that part of it is really important. And just programmatically, and I'll pass it back to you because I wanted to make a programmatic point. I think programmatically, like, a woman is coming for a method. Now, a counselor or the provider can very much test this. Like, the point is, this doesn't just have to be used in a demographic survey. This can become a very small checklist. It can be converted into a checklist where you ask a bunch of questions for yourself to see what is the context of her household. Is she able to talk to somebody? Is she able to talk with freedom about contraception? Does she feel pressure that she has to come and use this method right now? Is there somebody, when she faces side effects, would she be able to seek help and support from somebody? I mean, there's a bunch of questions that can be taken from these ideas, and we converted this into almost a counseling script. And I think that's where this also becomes very useful for the program. Over.
I want to add one quick thing. Sorry, I just want to say one thing, that, like Preeti said, that and I agree with her, we are in this particular presentation and some of the work, we are limited in the sense that we talk about married women. But when we are talking about reproductive agency, I think there are several other sort of groups whose voices, and we don't have that much evidence on what this even means. And I think there needs to be greater dialogue on that. So this is just a small part of a much bigger picture, like Preeti said.
Thank you, Nandita. Thank you, Priya and Preeti. There is another question. Is any data which suggests urban educated women versus rural educated women which have higher reproductive agency, reproductive autonomy?
We've not done this, but we will probably investigate if that is of interest to people. Yeah.
Another question is, what are the factors influencing women reproductive autonomy? Is gender disparity plays major role in it? The first one, anyway, Priya has talked about, but is gender disparity plays a major role?
Yes, definitely. I think when we're talking about women's reproductive autonomy, we are talking about the role of power, patriarchy, and so on. Gender disparities are essentially noted in when we measure them for men and women. But the real idea around patriarchy is not limited to men. Women can also exert the same norms, and so I think there needs to be a broader discussion on what those norms are, who believes. So, for example, a mother-in-law being a woman is also influencing or entrenching the same types of hierarchies that that exist in society. So I think we need to really investigate and really think about how our programs are breaking some of those stereotypes. Yeah, Preeti wants to add, I think. Yeah.
No, I completely agree, Nandita. So a couple of things, for example, we did in UP. One was, for example, there was this whole program around the SAS and SAS Bahu Sammelans, for example. So how do you bring men into the conversation, right? So, it became the whole framework, for example, was the whole program was changed to a SAS Beta Bahu Sammelan, right? Where the men, along with the mother-in-law and the wives, would come in, and the conversations around family planning, choices, whose choice needs to be honored, whose choices need to be considered, etc., were designed in the form of games, etc., which could be rolled out. So we need to start actively engaging men into the conversation so that both sides of the understanding starts to develop. Yeah.
I just wanted to say something to that urban educated, rural educated question, Abhishek. I mean, I just want to also say that these comparisons, I put it in the chat, these comparisons also have to be contextualized, because it could be completely confounded by the fact that what proportion of urban educated women are working outside the house and are being fairly compensated for their work versus proportion of rural educated women. So that comparison actually could play out in a population where urban educated women are more likely to be working outside the house and getting wages, may demonstrate higher reproductive autonomy on the average in rural educated women. So then it's not the education that is a determinant, but it's also whether you're going out of the home, whether you're getting compensated and recognized for your economically productive activities. So I would push that question back to say even our questions then have to get more nuanced.
Thank you, Priya. And I don't see any other question which we got. Do you think, Nandita, what are the broad factors do you think mobility and technology, etc., play in this?
Mobility is obviously, I mean, I think even in some of our work around mothers-in-law and so on, we found that especially younger married women, mobility is a big instrument for, controlling a woman's reproductive agency. So women who marry early, often like younger girls, often not able to take choice decisions regarding where they want to go, how, and go alone or make those choices, and have to kind of explain where they're going, why they're going, and so on. So I think mobility definitely is a very important instrument. I think technology, of course, I think like now the work on, technology can work both ways. Technology can, of course, be an instrument by which we deliver public health messages, just because like the world is bursting now with mobile phones and so on. But at the same time, I think women also often use phones as a mechanism for connecting with people. And so I think we have to really, I'm not a huge advocate for mobile phones, but at the same time, like, I think we have to look at the positives that technology can bring in the lives, the information that can come in. Of course, noise also comes in, as we might see with younger people, but I think we have to start thinking of them as instruments of empowerment more broadly.
Thanks, Nandita. Yeah, it does make sense. Priya, Preeti, any last reflections or any thoughts?
So, I mean, just on media and technology, I think like it has both the yin and the yang, right? It can be very, very empowering, but also it leads to a lot of potential surveillance. and control. So especially for women. So I think that is a really important thing. But I was just talking to a colleague yesterday where I learned that a study which showed that you give young women the phone, and the number of Facebook users really goes up, right? So that's the first thing they may do, is to get on to social media. And why not? I mean, that is where most of the people are interacting with each other. So I think what is important for an urban adolescent is equally important for a rural adolescent. And it's true that there may be a lot of misinformation and we need to be careful, but we have to allow that privilege to use that space, and also give a certain amount of confidence that, whatever information you get, how do you utilize? So that's where digital literacy becomes really important, rather than controlling it. Like, you have to allow the space and give the confidence and the literacy. Absolutely. So that people can actually use it and get the best out of what, good or bad. Like, we are all exposed to incorrect information. That doesn't mean we stop using the technology. So I think, like, we have to keep pushing the frontier of how much technology can be used and empowered, while we are enabling in that space especially for women and young girls.
No, absolutely. I mean, I second that completely. And since we're ending on the note of technology, I think a recent study that UPTSU just did, both on traditional methods and new contraceptive user journeys, 90% of the women interviewed during those studies quoted mobile phones as being the first point of information. So which means that, they are using it increasingly. Of course, the difference between the two was that they said that information around traditional methods was easier to understand on the internet, versus the information available on modern methods was complicated, too technical, and difficult to decipher, kind of a thing. But of course, I mean, they were still looking at using the mobile phones as the first source of information more increasingly, both around modern contraceptives and traditional methods. And that really seems to be seeping into everyone's lives. It is in ours. And so it is in everyone's lives, whether it is women in urban areas or rural areas. So I think that is one medium that we should increasingly explore, and also creates that sense of privacy where women are able to access information, go through information in the space of their own homes at a time which is most convenient to them, etc., etc. So I think it has great potential and power to kind of really move things where, we're talking of creating that correct information reach to young women, especially. Yeah.
Thank you, Preeti. Thank you, Priya. Thank you, Nandita, for the presentation and the discussion. And thank you all the audience for participating in it, putting your questions. And also in the chat, we have left the YouTube channel where the recording of this webinar will be available, as well as if you have questions, let's continue the conversation, and you can post your question on indiafpmle@gmail.com. Thank you, and have a wonderful evening.
Thanks all.
Thank you.
Thanks.